Hi, my name is Dr. Stephen Smith. I am the Chief Medical Officer for CareSouth, and I've worked with CareSouth for about 27 years. And I have the privilege of giving the coronavirus update for our organization. First off, I want to thank those of you who are listening to this, work for CareSouth, for your diligence. I know that in our organization and a lot of organizations, we're now checking people's temperature when they come to work. And if their temperature is elevated, making sure they get the medical care that they need. And we are trying to get more people to be able to work from home to decrease their interaction with other folks. But right now, I just want to kind of go over some of the numbers that we're seeing in South Carolina and a little bit of a concept about what those numbers mean. And although I'm certainly not here to make any predictions about the future, but just some guidance in regards to those numbers. So far in South Carolina, we have 33 cases as of today. Of course, tomorrow that number will be up. We have one death so far. At CareSouth, we have done testing for 10 patients. That number will go up almost by the hour probably. And so far, none of them have been positive. In fact, there are no confirmed cases of coronavirus in any of the 5 counties that CareSouth works with. So right now, I'm going to go over just again, so it's a little bit more with numbers. I like numbers. This is a bar graph, and on this blue line, it shows the number of people who the CDC believes die this flu season from the flu. And this is their low-end number, and it represents 22,000 patients. Down here, we have the number of people who have died so far of the coronavirus. And as you can see, it can't even compare with that 22,000. Now, someone might look at this and say, well, Dr. Smith is saying that the flu is way worse than the coronavirus. And unfortunately, it's not that simple. This number is going to start going up, sadly. Now, will it go up as high as the flu? Possibly. Will it go significantly higher? Will I have to adjust the graph to make more room? Well, yes, that's very possible. The head virologist for the CDC said it would be possible for it to go up significantly higher. Now, again, this is looking at deaths, not cases of the flu versus coronavirus. And then you bring in this something called mortality rate. What percent of people who get it unfortunately die? And presently, for the coronavirus, it's 1.77, but that number goes down literally by the day. As many more people come down with the coronavirus than fortunately die from it. Will that number drop all the way to the flu's number? Unfortunately, probably not. Again, the head virologist for the CDC says that is unlikely to happen. So you can't say that, well, it's just another flu. However, if everybody works hard and continues to do their best to be safe and avoid crowds and keeping your space, then as a nation, we're able to keep this graph down. And so as I give more talks, we'll see this number go up. I mean, that's for sure, but hopefully you won't see it get past. That's it. These talks are going to be very short and have some numbers that are specific to the counties that CareSouth works with and to the company, as well as some of the national level. Hope you enjoyed it.